Around the world, every sector of the poultry industry continues to evolve. This is not limited to quantitative changes, but includes qualitative improvements resulting from scientific research and new insights. This is true both for the various specialized aspects of the chicken industry and for the steadily growing production of turkeys, ducks, and pigeons. Poultry meat and eggs are staple foods all over the world. The FAO endorses this and encourages the development of the poultry industry as a whole. To optimize the production and yield of poultry farms, new technologies and management techniques are constantly being researched and developed. Poultry healthcare plays an essential role in this. The steadily increasing concentration of the number of birds kept under one roof continually demands improved prevention of diseases. Furthermore, existing diseases have evolved during the past decade and new diseases have developed. Examples of new developments include the isolation of the new variant strain of the infectious bronchitis virus IB491 and the discovery and demonstrated pathogenicity of an unknown bacterium in Intervet's research laboratories, Ornithobacterium rhinotracheale, which could have a significant economic impact. Accordingly, vaccinations, and particularly mass vaccinations, have gained importance. Modern poultry farms simply can no longer do without them. This program presents an up-to-date review of the most important vaccination techniques in relation to vaccine types and species and type of animal, contrasting, where possible, the different conditions encountered. The following types of vaccination will be discussed. Injection of inactivated and live vaccines. In ovo vaccination with live vaccines. Different methods of spray vaccination. Drinking water vaccination. Ocular and nasal vaccination. Wing web vaccination. Follicle administration. And oral vaccination. Intervet develops and produces a wide range of viral, bacterial, and parasitic vaccines. These vaccines can be divided into two basic groups. Live vaccines, which can or must be administered using various techniques, and inactivated or killed vaccines, which can only be administered by injection. The choice of a live or an inactivated vaccine and a particular vaccination technique depends on a large number of factors. The most important factors are the type of animal. Broilers, for instance, are mainly vaccinated with live vaccines because of their short life cycle. The age of the animals. Very young chicks cannot be vaccinated via drinking water because they drink very small quantities at very irregular intervals. The disease or diseases the vaccine targets. For EDS, for instance, only an inactivated vaccine exists. The type of vaccine. Vaccines such as the Rio Live vaccine and the Marex vaccine can only be administered by means of injection. Local conditions. Labor costs may be a decisive factor when choosing between mass or individual vaccination. The discussion on the vaccination techniques and vaccines will of course include all indications and recommendations. Inactivated vaccines consist of a water-in-oil emulsion to which a killed antigen is added during the aqueous phase during production. Because of the use of this killed antigen, inactivated vaccines can only be administered by injection. This offers several key advantages. Vaccination with an inactivated vaccine generally induces long-lasting, optimal and uniform immunity. Compared to live vaccines, an inactivated vaccine causes fewer systemic reactions. The use of inactivated vaccines requires fewer revaccinations in layers and breeders during production. The use of inactivated vaccines reduces the risk of interference, enabling the production and administration of more antigen combinations. Moreover, inactivated vaccines entail no risk of spreading of vaccine viruses or bacteria because killed antigen is used. The full range of inactivated poultry vaccines developed and produced by Intervet covers an extremely wide field. In addition, Intervet continually conducts research into new and improved vaccines. The last few years have seen the addition of a series of new vaccines as well as a number of combined vaccines. Intervet markets inactivated vaccines for bacterial and viral infections. Viral combination vaccines are commonplace these days. In 1985, Intervet was the first animal health company to succeed in producing a 4-way inactivated combination vaccine specially designed for breeders. Most inactivated vaccines are usually administered during the rearing period of breeding stock and commercial layers. Some inactivated vaccines, such as the ND vaccine Nobilis ND broiler, the Nobilis influenza vaccine and Nobilis FAV against the fowl adenovirus, can also be administered to very young chicks. This is done subcutaneously in the neck. In older animals, inactivated vaccines can be administered intramuscularly or subcutaneously in several different ways. Intramuscular vaccination can be carried out in the breast or leg. A combination of 2 vaccines is used here, the Nobilis Rio Inac vaccine and the IB Gumboro NDRT combined vaccine. For injection into the breast, the needle is inserted into the muscle parallel to the breastbone, with the needle pointing in the direction of the bird's head. During injection into the leg muscle, care must be taken to avoid damage to the joints or bone. The needle must be inserted pointing away from the hock joint, parallel to the fibula. This must be done on the outside of the thigh, because blood vessels and nerves run along the inside of the thigh. Sometimes, as in the case of older turkeys, the vaccine may be injected into the wing. When injecting into wings, it is important to avoid joints, bones and veins. Bacterial vaccines are generally injected subcutaneously into the neck. Some oil emulsion-based bacterial vaccines, such as coryza and fowl cholera, should only be administered subcutaneously in the neck. It is also preferable to inject E. coli and ORT here. It is important that the injection is given into the lower part of the neck with the needle pointing away from the head, as these images demonstrate. If location of the injection is higher up, just behind the head, this may result in swelling that causes pain and difficulty in eating and drinking. Day-old chicks are vaccinated subcutaneously in the neck. Automatic vaccinators can also be used for these day-old vaccinations, as is usually the case with Marex vaccinations. The following precautions should be taken during vaccination with inactivated vaccines. The vaccines must be kept cool and stored at a temperature of between 4 and 8 degrees Celsius. The vaccines must be allowed to reach room temperature before injection. A water bath to maintain the proper temperature may be used for this. Shake the bottles well before use and during vaccinations. Opened bottles must be used immediately to prevent contamination. Use only clean, sterile syringes with needles of the type 10 mm by 1 to 1.5 mm. It is essential that the syringes can be calibrated accurately, because all animals must be vaccinated with the correct quantity of vaccine. Despite the speed of the operation, the injection must always be accurately carried out. Make sure that the needle does not slide along the skin between the feathers. Make sure that the entire dose of vaccine is injected into the animal. No vaccine should leave the syringe before it is inserted into the animal, nor after it is pulled out. Needles should be changed regularly. We recommend a new needle for every 1,000 birds. And last, but certainly not least, only vaccinate healthy animals. The mass injection of animals with inactivated vaccine is usually a rapid process, sometimes even extremely rapid. Accordingly, the persons administering the vaccinations face the risk of pricking themselves, which is not entirely without consequence. Accidental injection may cause severe inflammatory reactions, particularly due to the mineral oil used in the vaccine. Always work with the utmost care to avoid injecting yourself. If you do prick yourself while administering inactivated poultry vaccines, always contact a doctor and show him or her the vaccine package insert. As well as being used in chickens, certain inactivated vaccines are also used for vaccinating turkeys, ducks, geese and pigeons. Turkeys are usually vaccinated subcutaneously in the neck, as demonstrated here. The most commonly used vaccines are TRT, ND, erysipelas and fowl cholera. Older turkeys, such as these 22-week-old breeders, may be vaccinated in the wing by injecting the inactivated vaccine into the large wing muscle. Always avoid nicking joints or bones, and particularly avoid insertion into veins. That is why this injection is administered on the underside of the wing. The veins are clearly visible on the underside, and the needle does not have to be inserted through feathers, thus avoiding contamination. Ducks are vaccinated with inactivated vaccine against Rimarella annatipestifera and fowl cholera. As the vaccines Nobilis FC and Nobilis Rimarella annatipestifera are oil emulsion-based bacterial vaccines, these must be administered subcutaneously in the lower part of the neck. Also, day-old ducklings must be vaccinated subcutaneously in the lower part of the neck. Both automatic vaccinators and handheld injectors can be used for this. geese, such as these free-range geese, are also vaccinated against fowl cholera. This is only done subcutaneously in the neck. Pigeons can be vaccinated against paramyxovirus disease with the inactivated Nobilis paramyxo vaccine that was specially developed for use in pigeons. This is a grandparent stock of meat pigeons in France. The injection must be administered subcutaneously in the lower half of the neck, with the needle pointing away from the head. Use a 10 mm by 1 mm needle for this. Many of the live poultry vaccines can be used for mass vaccinations. There are, however, also a number of individual vaccination techniques used for live vaccine administration. The technique that may or must be used depends on several factors, including the type of vaccine, the type of animal, the animal's age, as well as management aspects such as housing system, available labor, and labor costs. The main vaccination techniques for the administration of live vaccines are vaccination by injection of young and older poultry, in ovo vaccination of chicken embryos, spray vaccination, drinking water vaccination, ocular and nasal vaccination, and finally, 3 vaccination techniques that we will address in one single chapter: wing-web vaccination, follicle administration, and oral vaccination. Injection of live vaccines is used for vaccination against diseases caused by the Marex virus, the reovirus and the CAV virus, and by Salmonella. The vaccine must be prepared prior to administration using an appropriate sterile solvent. The clarity and color of this solvent must be thoroughly checked. It is imperative that it does not contain any sediment, while turbidity or a yellow discoloration may mean that it has been contaminated with bacteria or fungi. It goes without saying that the vaccine must be dissolved under the most hygienic of conditions. The dissolved vaccine must be used as quickly as possible, preferably within 2 hours. When vaccination does not start within half an hour, the dissolved vaccine must be kept and transported on ice. A special sterile dye can be added to the solvent. A concentration of 1 milliliter of dye to 1000 milliliters of solvent, or half a milliliter to 500 milliliters, is sufficient. This can be used to simply check whether the animals have actually been vaccinated. we have shown you images of diluting a freeze-dried Marek vaccine. There are, however, also cell-associated vaccines. These vaccines are stored and transported in liquid nitrogen at a temperature of -196 degrees Celsius. This extremely low storage temperature presents the small risk that an ampoule may burst when suddenly removed from the liquid nitrogen container to an area at room temperature. This is why these cell-associated vaccines must be thawed very carefully. Always wear safety goggles or a safety mask and gloves. The vaccine is thawed by placing the ampoules in a water bath with a temperature of 25 to 27 degrees Celsius. Before opening, the outside of the ampoule must be dried with a clean paper tissue to avoid contamination from the water bath. Change the water of this water bath at least once a day. Always use a large gauge needle when dissolving a cell-associated vaccine in order to avoid damaging carrier cells. Immediately after the vaccine has been thawed out, it must be added to the appropriate special diluent, diluent cell-associated, which must be at room temperature. The ampoules must be rinsed once using the solution. Once thawed, a vaccine may never be returned to the nitrogen container. When the dissolved vaccine is to be kept for more than half an hour before use, it must be stored and transported on ice. Certain freeze-dried vaccines, such as Nobilis Rio 2177, can be mixed with Interfet's cell-associated Marek vaccines, which of course yields significant time savings during vaccination. Chicks at hatcheries are generally inoculated using automatic vaccinators. Day-old chicks must always be vaccinated under the most hygienic of circumstances and consequently in very clean areas. The vaccine is administered to chicks subcutaneously in the neck or intramuscularly in the leg. Regular checks of the accurate setting of the equipment are required to ensure that each animal receives the proper amount of vaccine. One way of doing this is by measuring the quantity of vaccine per 10 or 20 injections and by counting the number of boxes of chicks per bottle of vaccine used. During vaccination, the vaccine solution must be regularly agitated by gently swirling it, and needles must be replaced frequently. Handheld vaccinators can also be used when day-old chicks must be vaccinated subcutaneously in the neck or intramuscularly in the leg. vaccine bottles should preferably be fitted with bacterial filters. That way, the vaccine is protected against contamination by the ambient air drawn in for the injection mechanism. The use of handheld vaccinators is subject to the same recommendations as automated vaccination. Finally, and that holds true for all live